Welcome to another episode of the Venari Podcast. As part of the Health Tech CEO series, it's a great pleasure to welcome Tormod Thompson, CEO of Picterus. Good to have you here, Tormod.
Thank you, Christian. It's a pleasure to be here. I'm looking forward to tell you about Picterus.
Yeah, please do tell us about Picterus. What made you join the company initially?
Well, I joined the company as a chairman and a small investor 3 years ago after having met the two of the founders in the beginning of 2020. And the reason I joined was that I really liked the technology and the mission of the company to improve jaundice management and really make a difference in low resource settings where babies are suffering from severe jaundice, resulting in brain damage or even death of almost 200,000 babies every year. And that was also the idea behind Picterus. One of the founders is a pediatrician. He was doing his master's in global health at Yale and traveling Africa, Sub-Sahara, and Southeast Asia. He realized the magnitude of the problem with untreated jaundice. And jaundice is a very common condition in newborns during the first 2 weeks of life. And if you detect it early, it's easy to treat jaundice with phototherapy. But if you don't, and the condition develops, it can lead to, as I mentioned, severe brain damage or even death, which is unnecessary. But problem is that available technology today does not really allow for effective low-cost screening out of hospitals. And that's what we are addressing in Picterus. We have a smartphone-based solution for screening of jaundice. So using a very simple calibration card that you put on the chest of the baby and an app that you download on your smartphone, we can deliver the same accuracy on screening of jaundice as you can with very advanced medical devices that costs between 5,000 to 9,000 euros.
That's fantastic. And obviously you said that you joined, three years ago. So how long has the company been around?
Company was started in 2015 and was really managed, I would say, on small funds, hand to mouth by the founders the first 3-4 years. And then in 2019, company received an EIC accelerator grant and equity that really kicked off the product development. And in end of 2021, we received a CE approval for the first product. And that's also when I transitioned into the CEO role, because we had a product that we could sell, but we didn't have an experienced commercial team. So I transitioned into the CEO role, having 20 years of experience in building companies like this in the global market. And
what would you say that the change has been then over the past 3 years since you've joined Tormod?
Well, this company, as many startup companies, initially had almost all its focus on technical development, technical product development, and then clinical studies, right? And probably didn't pay that much attention to how the product was going to be positioned in the market, how the shareholder structure and the financing plan for the company should look like. And I think those are probably the lessons learned when you've been around this or been in this process before, right? That to get those things sorted early on is also quite important to become successful in the market. So I think the last 18 months, when I've been the CEO, we really sort of transitioned the mentality of the team to put the market and sales and what is needed to drive sales as our top priority and make regulatory, technical, and clinical decisions accordingly.
Absolutely. And I think, as you mentioned, you just had the CE approval, or 18 months ago. Would you say that the company has international ambitions? Like you're obviously in Europe at the moment. You're headquartered in Norway.
No, we definitely have global ambitions, and as you say, we have our CE approval now that gives us market access to a number of countries. Of the 140 million births annually, 50,000 of them are in Norway, right? So this company is not going to be successful by being the market leader in Norway. So we already established distributors across Europe, some in Southeast Asia and Middle East, and we are in the process of getting, or hopefully getting, market approval in the US. We have submitted a 510(k) application to the FDA that we expect to hear back from this autumn, and if we have a positive decision, we will definitely also launch and start activities in the US.
Yeah, that's fantastic. And you've also had the beginnings of a new partnership with the US, haven't you, as well?
Correct. We are entering into a partnership with Intermountain Healthcare, which is in our opinion, a fantastic healthcare system in the US with very skilled neonatologists that really understand the need of changing the way jaundice management is done today. And I think there are two main problems. If you look in the high resource settings, clinically, jaundice is not really a major problem, but we are spending a lot of resources to manage newborns with jaundice. And as you may know, 60 to 80% of all newborns will have some level of jaundice, while only 6 to 8% will need treatment. But 50% of all those babies will be at risk of developing severe jaundice. And we spend a lot of resources screening those babies. Mm-hmm. And the two problems we are having currently is that some of these babies are coming in too late because they are discharged from the hospital maybe 24 to 72 hours after birth, while jaundice peaks 3 to 5 days after birth. So those babies are at home, not being monitored properly, and they come in late to the hospital, and they will need a lot more phototherapy and also, in worst case, blood transfusion to manage the jaundice situation. The other problem we are having is that way too many babies are coming unnecessary to the hospital or to the clinic for screening, right? Because there are no home-based or out-of-hospital solutions available for accurate management of jaundice. And that's also what we are addressing in the partnership with Intermountain, that they have approximately 1/3 of their babies after discharge will come back for a second test. And they want to reduce that number of babies coming back to spend more of their resources on babies that really need a follow-up from the hospital. And we see exactly the same with partners across Europe and elsewhere, that this is the main issue, right? That the healthcare system doesn't have enough resources, both in terms of personnel or money, to deal with patients that are not really patient, because most of these babies are at risk, but they are healthy. So they can be managed in a different way than they are today. So this is not only a technology for screening, but also a possibility to really change the patient flow and how the healthcare system is dealing with this patient group.
Given that, and given kind of the international ambitions, as you mentioned, where do you see Picterus in, let's say 2 years' time? I appreciate not an easy question.
It's not an easy question. I mean, right now we are really pushing and focusing on establishing sales and getting revenue growing in the markets where we have launched, because after 8 years, we need, the trustworthiness of the company and the credibility in our solution really lies in driving revenue. Right? Given that we are successful in growing revenue in the markets we have launched, I see no reason why we shouldn't have global ambitions and become a global leader in jaundice management over the next 3 to 5 years.
Absolutely. Well, fingers crossed, certainly. And final question, Tormod. As a CEO, like you say, 20 kind of years plus experience in helping startups to expand and grow commercially. Like, do you have any advice for health tech CEOs?
I think my experience is really a little bit what I mentioned earlier, that early on in the company journey, you need to really think about what is the actual product we are making, what is the pain we are solving, how are we going to position it, who is going to pay for it. Mm-hmm. So that whole commercial piece, I think, tends to be neglected early on. Most founders are very occupied with their idea, the technology, and the product, and that part of it. So that's definitely one advice. The other would be to really have a good plan for who's going to be the shareholders of the company early on. Right? And again, a lot of founders tend to sort of cling on to their percentage of shares in the company without really thinking about the value of those if the company doesn't succeed, right? So I think those two lessons learned is probably the best advice I can give them.
Yeah. No, thank you so much. And I really appreciate you coming on, Tormod, and telling us a little bit more about Picterus and where you guys are going. And I'll certainly be keeping an eye from the sidelines. But thank you so much.
Thank you, Christian. My pleasure to be here. Thank you.